The broadcast is now starting. All attendees are in listen-only mode.
Hello there, this is Sophia Asan of the RHSC Secretariat. We have people coming online, so we'll just wait a couple of minutes so more people may be able to join. Hello, this is Sophia Asan of the RHSC Secretariat and of the MDA Working Group. On behalf of the working group and the coalition, we welcome you all to this webinar. And welcome you on behalf as well of Andrea Baer, the chair of the MDA Working Group, and myself. We're excited to have this webinar today that is discussing the relationship between stewardship and TMA with specific experiences in a few very different countries. Kate Klein and Cindi Cisek will be leading the discussion. So Cindi and Kate. And I also want to, on an administrative note, to let you know that all of the attendees are in listen-only mode throughout the presentation. There's a questions box, and you can feel free at any time to type in any questions that you have. When the presentation ends, we'll have a Q&A period with whatever time is left and answer your questions. So Cindi and Kate?
Sophia, thank you very much. Good morning, everyone. Thank you for that introduction and, of course, for the invitation to be here today. And thank you to all of the various participants who are listening in. We certainly appreciate the opportunity to discuss some of the findings from our recent article and the implications in terms of the way forward on how we can better use TMA as an analytical and policy tool for improving the stewardship of health markets. And as Sophia mentioned, my name is Cindi Cisek. I am a senior technical advisor for Palladium's America's Health Practice, and I am based in East Paris, Mexico. And my colleague Kate Klein, who is a senior associate for the private sector in the same America's Health Practice, is based in Chicago. And this paper was published in February of this year in the Public Administration and Development Journal special issue on stewardship and health system strengthening. And it was co-authored by myself, Kate, Sayaka Koseki, another Palladium colleague, and Rob Wood, a former Palladium colleague. So thank you again for the opportunity. So here's what we'll cover. Next slide. Here's what we'll cover in the next 45 minutes or so, and our plan is to try and leave some time at the end for discussion and or specific questions. So we'll start with a brief overview of some of the TMA and stewardship concepts for those of you who may be less familiar with those terms, and then go into an overview of the findings of the stewardship article and some of the detailed findings of the 3 different countries featured in the paper. Our interest in writing this article stems from our mutual exposure to total market approaches in different contexts, global in terms of the thought leadership dialogue that has been going on for a while now, and also at the country level. And we realized that although TMA practitioners are increasingly talking about stewardship as being critical to TMA implementation, there was fairly little documentation in either the gray or the published literature about the roles and functions of stewardship as they related to total market approaches. So then we'll also talk about some of Palladium's work, and specifically under the HP Plus project's recent work in trying to articulate what it means to move from TMA market analysis and advocacy into action or to implementing specific market shaping interventions. And then finally, a brief commentary on how all of this links to USAID's vision for helping countries achieve their journey to self-reliance. So here on the next slide, you can see that we defined TMA as an analytic and policy framework that supports ministries of health and their partners in addressing the health market inefficiencies, in improving the targeting of government and donor resources, and building linkages with the private sector. And our literature review for the article suggested that TMA basically has evolved in response to 3 factors. One was the phase out of donor support for reproductive health and family planning, and in some cases HIV commodities, specifically condoms. Secondly, increasing advocacy by donors and implementing partners to governments to increase the financing of some of these essential health products and services. And 3, the increased recognition of the strategic role of the private sector in health markets. So the infinity graphic on the right is Palladium's TMA framework that basically outlines 6 different processes. First is analyzing and understanding the market dynamics. Second is understanding the comparative strengths among the market players. Third is engaging key stakeholders, both from the public and private, profit, and nonprofit sectors. Fourth is actually looking at ways to strengthen the stewardship capacity. 5 is then moving into the implementation or action phase and supporting market shaping interventions. And then finally, 6, what can we do to actually monitor the impact of those interventions and on the total market. So I think what's unique about this framework is it demonstrates that TMA is an iterative process and suggests that part of the process is actually moving into supporting these market shaping interventions, and then of course to the phase of trying to see and monitor the impact of those interventions on the total market. And as we've seen in many country programs, there is a need to get beyond sort of these early phases of analysis and advocacy and move into the action and market shaping. And getting stakeholders, country level government stakeholders, aligned to a strategic vision and then implementing those market actions. And we know that there are a lot of changes in moving toward those later phases. So the next slide. In the paper, so our objective was to identify what ways TMA processes influenced or to strengthen specific steward functions, and based our paper on the stewardship functions presented by Travis Davis McFall in their WHO paper, Toward Better Stewardship, Concepts and Critical Issues. So the stewardship functions that you see here on the slide are largely based on that paper, with a few minor adaptations that are aligned with our TMA framework. So the first is generating intelligence, and obviously TMA uses an evidence-based approach to understanding the total market for products and services, and emphasizes the inclusion of the private sector, nonprofit and for-profit sectors, and data or market intelligence collected through TMA assessments, through LMIS and TIS data, through DHS data, through market segmentation analyses, and in the process engages stakeholders in reviewing, analyzing, and presenting the results. And this kind of market intelligence has been done in many countries. The second function is formulating strategic policy direction. So how do we use that market data to help shape national policy and strategy and actions that include TMA concepts, or more importantly, include the recognition of the role of the private sector. So for example, in the case of Uganda, we'll talk about a little bit later on in this presentation, is, Uganda actually developed, and one of the first countries to develop, a draft national TMA strategy that analyzed family planning markets and began to outline actions for the way forward. And then thirdly, looking at building coalitions and partnerships. So how are we establishing the platforms for multi-sectoral dialogue to include the private sector? And TMA often serves as an impetus for ministries of health and those reproductive health or family planning stakeholders to engage in multi-sectoral dialogue with participants from NGO sector or social marketing sectors and even the for-profit private sector. So we've seen these types of platforms being established in several different countries. And then fourthly, ensuring that there are the appropriate tools for implementation. So we defined this stewardship function as recognizing how public policy influences market behavior. So understanding the barriers and incentives to private sector growth, and then do the governments or ministries of health have the resources and regulatory framework to oversee quality and compliance in the private sector and address some of the potential market barriers. Fifth is aligning policy objectives and market interventions. So implementing interventions that will actually shift the market to improve efficiency or equity or to increase the private sector's engagement, obviously in alignment with what the national priorities are. And then finally, accountability and transparency in health markets and making sure that there are appropriate indicators and monitoring mechanisms to track any changes in the overall market. Next slide. So now in this section of the presentation, we'll talk about some of the key findings from the paper at the country level and suggest and share what evidence we found in terms of how TMA was supporting stewardship strengthening. So just a quick word about methodology, and in selecting the countries, our criteria focused on identifying countries with ongoing efforts to implement TMA practices at the national level, and countries, obviously, where we would have access to key stakeholders. So we do recognize that there is a potential bias there in the country selection. And we ultimately focused on Mali, Uganda, and Kenya. Also, as a part of the paper, we did an extensive review of the TMA and stewardship literature, and for the 3 countries looked at any other documents that were related to national level policy and TMA implementation, such as PSAs or total market assessment, case studies, market segmentation analyses. And we also did semi-structured interviews in each country with the Ministry of Health representatives, international donors, NGOs, and private sector partners. So now we'll talk about Mali. And as you know, Mali has some of the poorest health indicators in the world. The modern contraceptive prevalence rate for women has increased only moderately from 4.7% in 1987 to 10% in 2013. And during this time, the public sector has continued to be the primary source for family planning services. So over 70% of all family planning services are provided by the public sector. And I think we could say that one of the early introductions for the government and reproductive health and family planning stakeholders to TMA principles was in 2014 at a regional TMA conference sponsored by UNFPA and PATH, where representatives of the Ministry of Health and the Directorate of Pharmacy and Medicines participated. So this slide focuses now on the first 2 key functions, generating intelligence and formulating strategic policy direction. And we present some of the examples of the evidence that was found through the literature review and the in-country interviews of how TMA supported stewardship strengthening. So for Mali, like many countries, there is quite a lot of evidence in terms of in terms of market generation intelligence, and starting around 2013 with PSI and UNFPA sponsored condom case study, which provided a snapshot of what was happening in the condom market at that time and identified some key policy barriers, such as the pricing issue for condoms, where there was a maximum price level for all commercial condoms. Following that, there was also a 2015 market segmentation analysis done for OCs and injectables, supported by the USAID-funded KJK project. And then where it starts to get interesting, I think, is when the Ministry of Health and the DPM begin leading their own efforts to collect data around contraceptive procurement and distribution data, and trying to better understand what other NGO partners were doing around family planning and reproductive health in terms of both procurement and service provision. And I think that was the first time that the ministry had endeavored to do such an exercise. So we concluded that these market intelligence activities help to improve the MOH's understanding of the private sector's potential role in reproductive health and family planning markets, and the need to share information across public and private sectors. And then in terms of strategic policy direction, we also found that the Ministry of Health and DPM had updated and validated a TMA action plan with key NGO and private sector stakeholders that identified specific roles and responsibilities for the various players, and also that Mali's health sector strategy plan developed by the government directly, although it did not mention TMA specifically, did recognize the importance of the private sector and the need for improved multi-sectoral coordination. So there was a recognition that better coordination with the private sector was essential to Mali achieving its health goals. So the next two stewardship functions focus on building coalitions and partnerships and the tools for implementation. So in terms of the coalition building, we found that the Ministry of Health was leading an official platform for TMA dialogue, although largely supported by external donor funding. And respondents suggested that the for-profit participation in those activities existed, but recognized that private sector engagement needed to be further improved. And then in terms of tools for implementation, there was relatively little evidence of that type of a stewardship function, but some recognition among key stakeholders of specific policy issues and market barriers, but little action to address any of those specific barriers, which is why there is the red X under tools for implementation. Next slide. So for the final two stewardship functions, again, there was little evidence of TMA supporting or helping strengthen these two steward functions in Mali. Interviews with the Ministry of Health and other TMA stakeholders did not provide any evidence of efforts to align the priorities outlined in the TMA Act Plan with particular specific market interventions. And then finally, there were no efforts to monitor specific TMA indicators or market data across the sectors. Next slide. So now we'll talk a little about Uganda. And Uganda's modern contraceptive prevalence rate has improved significantly from 26% in 2011 to 35% in 2016, but is still far below the Ministry of Health's goal of 50% by 2020. And the government currently provides 58% of all family planning services, so slightly less than Mali, but an increasing recognition by key stakeholders in Uganda of the need to have better sustainability in their family planning markets, and of course for the impending phase out of donor support. So in terms of generating intelligence and that specific stewardship function, there is certainly ample evidence of intelligence generation around the role of the private sector, starting again with a TMA condom case study done by PSI and UNFPA in 2013, a TMA landscaping study done by PATH in 2015, a USAID-funded condom market landscape study in 2017, and a total market family planning assessment done by UNFPA also in 2017. So it's obvious that TMA is not a new concept in Uganda, and there have been multiple efforts to develop data and to help stakeholders understand the comparative strengths and weaknesses of the various sectors. There is also evidence of that data helping to support the development of strategic policy guidelines. So for example, as I mentioned previously, the Ministry of Health had developed a national TMA strategy, a draft national TMA strategy in 2017, and also their national comprehensive condom plan that had integrated TMA principles and recognizing the importance of the role of the private sector. So again, various policy documents recognizing the private sector and the importance of total market growth. In terms of building coalitions and partnerships, the Ministry of Health is strengthening coordination through multi-sectoral engagement mechanisms. Multiple stakeholders had identified market barriers that affect private sector expansion, but there's little concrete evidence on how to address them. And some specific examples around condoms included the very lengthy lengthy testing process for condoms, the lack of strategic policy around how free condoms were being distributed. And another interesting development in Uganda is with the Samasha Foundation, which has also been a strong local advocate for TMA and supporting the government in a few key areas. So in summary, there's quite a bit of evidence in terms of how the Ministry of Health is looking to build coalitions and partnerships, and less evidence around the increasing the actual tools for implementation. And on the last two stewardship functions, again, little strong evidence of TMA supporting the strengthened stewardship in these areas. Both Ministry of Health and NGO respondents suggested that there was no strong consensus on how to align policy objectives and market interventions. Indeed, this is probably the hardest part. And other respondents suggested that another complicating factor is that donor initiatives are often not well aligned as well. And then in terms of accountability and transparency, again, little evidence of total market monitoring mechanisms and data to monitor market activities was also limited. So I'll stop there, and Kate will now talk about the findings from Kenya.
Great, thanks, Cindi. I'm going to continue on in a similar fashion. Just to give you a little bit of context before getting into the stewardship functions for Kenya. Kenya's in a little bit of a different situation here. Kenya's MCPR is the highest of the three countries. So it had increased from 27% in 1993 to 53% in the most recent Kenya DHS, which is actually 2014. And Kenya's recent status as a lower middle income country has meant that external support from donors is really now starting to decline. So beginning in 2016 and 2017, donor support for family planning commodities was significantly reduced. So that left a funding gap of $4.8 million in 2018, and they projected that out as a funding gap of $6.3 million in 2019. So clearly, you know, the case for improving family planning market sustainability is there. And now let's go into the stewardship functions and see kind of what they've been able to accomplish. Okay, so in terms of the first two stewardship functions, generating intelligence and formulating strategic policy direction, Kenya checked the box really on both of these. For the generating intelligence side, there has really been no shortage of studies and analyses done in Kenya to understand the market. So a lot of the evidence that we have here is from the Eshe project, which was a Palladium implemented project in Kenya. Starting back in 2015, there was a family planning market diagnostic study that sort of looked holistically at family planning market dynamics at both macro levels and micro levels, and helped inform subsequent TMA discussions with Kenya's main family planning stakeholders. Following that, in 2016, there was a market segmentation analysis done, which showed surprisingly actually strong equity across wealth quintiles in terms of MCPR, but interestingly showed that there was a relatively high percentage of the top 2 wealth quintiles who were accessing their methods through the public sector, which sort of suggested an opportunity for better targeting. Another example included quantification of the commercial sector market, and this was actually the first time the government understood the role of the commercial sector in terms of how big of a role it was playing in the family planning market. So this analysis uncovered that approximately $1.3 million in contraceptive commodities was commercial, which was far more than previously thought. And then finally, a supply chain distribution analysis was conducted to uncover other inefficiencies across the supply chain. So you'll see here, these types of studies and research are examples of improving market data that could be used to influence the Ministry of Health and donors' perceptions around a couple of things, like accuracy of family planning forecasting and supplies, as well as understanding what the required funding levels are moving forward, and then how to address the market distortions that are cropping up. In terms of strategic policy direction, some of these market analyses and intelligence generation activities really helped prompt activities related to this function. So the Ministry of Health's Reproductive and Maternal Health Service Unit led TMA stakeholders to develop a national TMA action plan. So in this action plan, it actually outlines specific outcomes and an implementation timeline. The Ministry of Health also incorporated TMA principles into its 2016 Family Planning Costed Implementation Plan, as well as a couple of other important strategic and policy documents. So TMA principles were also incorporated into the RMHSU's annual plan and the National Reproductive Health Strategy. This also, basically attention to incorporating TMA into policy also led to scenario analysis and planning at the national level. And they developed a transition plan that expands family planning products and targets for those that can afford to pay commercial prices. So through all this evidence, we're seeing that the MOH is taking steps to achieve a more efficient market system through their policy actions. In terms of the next 2 stewardship functions, building coalitions and partnerships and ensuring tools for implementation, Kenya also checked the box on both of these to some extent for the tools for implementation side. But in terms of coalitions and partnerships, what we saw here is that the Ministry of Health established a TMA working group for family planning stakeholders, which reported into the National Family Planning Working Group. And this subgroup actually represented the first time that the commercial sector had been engaged directly with public health decision makers. This subgroup focused on very specific issues that had been identified through this earlier stage I just discussed, the generating intelligence stage. And one big issue that got a lot of attention was the current government policy that promotes free family planning products to all Kenyans, regardless of ability to pay. So the data show that more than half of middle and upper income women in urban areas were accessing free pills, free injections, and free implants, again, suggesting an opportunity for better targeting of resources. So we heard from respondents that at this stage, government leaders were motivated to reevaluate national contraceptive distribution strategies. So as you can see, the TMA subgroup, increased dialogue among not just the MOH, donors, and other typical stakeholders, but also included the commercial sector and helped build consensus and pave the way for reevaluation of the status quo. On the ensuring tools for implementation side, we saw that Kenyan stakeholders were really starting to understand the barriers that inhibit the growth of the private sector. And one salient example here is the understanding that the private market was being distorted, in part because private providers could access free products from the public sector, which resulted in quite a bit of leakage into private sector outlets. which caused some of the market trends that we have been exploring. And this had generated significant interest and advocacy from the government of Kenya, really to start making some reductions of free supplies to these private sector providers. So overall, Ministry of Health stakeholders in Kenya have developed definitely an increased appreciation and understanding of the potential role of both the commercial sector and the not-for-profit NGO sector in family planning, and they're working towards implementing important regulatory changes, although they're not quite there on being able to enact what they were advocating for. Moving on to aligning policy and market objectives and accountability and transparency. Kenya was partially playing these roles, but not entirely. So on the aligning policy and market objectives side, sort of the context for the evidence that I'll lay out in a second is that Kenya's TMA segmentation strategy had identified the need to make commercial products more available to relatively wealthy urban-based family planning users, leaving social marketing and the public sector to concentrate primarily on, more lower income communities compared to these wealthy urban-based centers. So as a result, Kenya's TMA subgroup encouraged private sector companies to introduce new family planning products to target specific consumers with the ability to pay. So this resulted in Sai Pharmaceuticals introducing a couple of new products, new combined oral contraceptives, progestin-only pills, emergency contraception, and these were targeting gaps for the middle market consumer. Then we also had DKT introducing Sayana Press for younger women of reproductive age who could afford to pay more than a typical injection user, but these women were still benefiting from a partial donor subsidy. So despite these new product introductions, which took into account efforts to avoid market distortions and target different populations in a differentiable fashion, respondents mentioned that donors still needed to really strengthen their own alignment and their own coordination around TMA. And this was because they have the ability to influence programming and funding down the line. So overall, several donors were really in support of different market interventions to increase the role of the private commercial sector, but they're really still not entirely aligned, which is the reason that there's a partial check here for this function. Oh, sorry, skipped accountability and transparency. So for this function, Kenya was the only country that really took steps to fulfill this here. We saw that they were doing an annual data collection exercise to track growth in the for-profit commercial sector. They were also monitoring family planning stockout and supply chain issues in the public sector. And then finally, they were doing regular monitoring of unintended market distortions. So Kenya's TMA subgroup was responsible for heading this up, and they established several important mechanisms to improve accountability and transparency by monitoring some of these short-term changes in the family planning market. Although we recognize that some of these methodologies in and of themselves haven't necessarily had time to be cemented as foolproof methodologies for constant monitoring of the market. Okay, so moving on to more of a review of what you've just seen with all of these check marks together across the three countries. Well, you see that the three different country experiences demonstrate really varying quality of stewardship for family planning markets and for private sector engagement. All three countries showed stewardship functions of generating intelligence, formulating strategic policy direction, and building coalitions and partnerships to some extent. Market segmentation analysis was the most prominent, being the most widely used, as well as other market intelligence data collection tools. Overall, countries were pretty strong on this front in generating intelligence. Other stewardship functions, like understanding market barriers and incentives, getting to the point where they're aligning market interventions and doing proactive monitoring of markets, those reflect a more full TMA implementation and haven't yet been seen in all countries. So where does this bring us in terms of some conclusions? Why are we seeing these achievements across the first 3 stewardship functions and not as much when it comes to understanding market barriers, aligning market interventions, and then doing this proactive monitoring of the total market? And, we believe in simplistic terms, I guess, that this boils down to the fact that the final 3 are really hard. They're not linear. They're not straightforward processes. And a couple of key things can sometimes get in the way. The first, regulatory environment. So we know that market development can often be affected by important market barriers mentioned by many of the respondents. These can look like price controls. These can be complex or lengthy registration and testing procedures. It could be leakage of public sector and donated commodities into the private sector, like we've seen in Kenya. Or it could be just simply unclear or outdated policies for distributing free family planning commodities. Another challenge that can sometimes stand in the way is incentives misalignment. So, some market players are going to have a strong vested interest in the status quo, in how things have been done traditionally, which makes for a complex consensus building process that actually requires the government to play this really difficult role in aligning incentives across multiple players to bring about reforms. So in TMA platforms and in the literature thus far, this need for effective stewardship of the regulatory environment, as well as this need to align market players, has been widely discussed. And this article, contributes to the evidence that there are still a lot of challenges to sustain stewardship in these last couple of areas. So I wanted to move away from the article for just a moment, since we're speaking of some of these more difficult stewardship functions. We've often seen that it can be very hard to move beyond generating intelligence and building coalitions. And countries may need an extra resource that can help them sort of map the interventions they might be able to take to the policy objectives they're trying to accomplish in order to align the incentives of multiple different players. So we want to share a new HP Plus resource that's available online with you that speaks to taking one of the next steps in stewardship functions, specifically understanding tools for implementation and aligning policy and market objectives. So we know that even when stakeholders may be bought into the idea of TMA, they may not really know what interventions can be taken to reduce market distortions. So HP Plus developed a market interventions brief that defines and captures examples of market interventions that can be applied by different market players within a total market approach. So in the document, there's this helpful table that lists different market actions that each of the stakeholders can take and maps them to different policy objectives that their country may be keen to promote. So the market players that we looked at and that we provided example or illustrative interventions for were government and regulatory bodies, donors and TMA practitioners, NGOs and SMOs, and of course the commercial sector. And then in terms of the market intervention objectives that their actions were mapped against, we looked at policy and regulation, we looked at financing and resource allocation, we discussed interventions around products and services, and also interventions around distribution and marketing and promotion. Okay, so we wanted to take a moment to think about how this all ties back to the concept of self-reliance, which we know is a key objective of donors like USAID. It's a broader movement and conversation in global health and development right now. So to start off, we've seen that in USAID documentation, there's kind of these 4 important components that overlay the idea of self-reliance. And these are, empowering host country governments and partners to achieve results that are locally sustained, helping countries mobilize both public and private revenues to domestically finance their own health systems, strengthening local capacities, and then finally accelerating enterprise-driven development. So TMA, as the policy and analytical framework that we've discussed today, has a unique ability to strengthen stewardship of governments, which means that it would be able to improve their capability to oversee core stewardship functions like we discussed today. For example, they would be better able to take charge of understanding their markets and better engaging the private sector. So from that perspective, you can really see how in strengthening stewardship for health markets, you're really strengthening local capacity and private sector engagement. And TMA supports this journey to self-reliance. So I think with that, we thank you all for your time and attention and letting us share our findings with you all. And now I think we can open it up to any conversation or questions. So thanks, everyone.
So hi again, this is Sophia Asan from the Reproductive Health Supplies Coalition. And thank you so much, Cindi and Kate, for the great presentation in discussing the relationship between stewardship and TMA and the experiences in the 3 different countries. Questions have started to come in, so we can certainly use the time that is remaining to address the questions that participants have had today. And to begin with, one participant is asking about the lack of tools implementation in both Mali and Uganda. So either Cindi and or Kate, would you like to comment further on the lack of progress in the area of tools implementation for Mali and Uganda, say, relative to Kenya?
Thank you, Sophia. I think that for the purposes of the paper, what we were really looking for was evidence of how TMA in those different contexts may have supported the governments in, first of all, better understanding what some of the policy and regulatory barriers are to private sector growth, and then moving from having that recognition of what some of those barriers were. So, for example, in the case of Mali, around condoms, we knew early on, since PSI did their initial condom case study, I think in 2013 in Mali, that one of the barriers for increased commercial sector engagement was related to a maximum pricing issue. And as I mentioned, I think in the case of Uganda, there are other policy and regulatory barriers that both the for-profit commercial sector mentioned to us multiple times, again, in this case in terms of condoms, for example, around the testing procedures and the costs for testing, and some of the timeline that and the implications of that in terms of what it means for the commercial sector and having their products sit in a government warehouse for 3 or 4 months while it's being tested. So those were the kinds of things that we were looking at in terms of understanding or identifying specific market barriers. So I think in both cases there was some early recognition of what those barriers are or were at the time, but little evidence in terms of a clear way forward, and how to address some of those barriers. So I hope that provides a little bit more context.
Great, thank you. And moving on in the questions, we have a question specific to Uganda, asking if contraceptives were not explored other than condoms, why might that have been the case?
I think I was just, in the case of Uganda, we were just giving the example of condoms. Condoms has actually been very well studied in Uganda, but what's interesting is that the Ministry of Health, their national TMA strategy actually looks at all methods. And so I think Uganda may have been one of the first countries to actually have a draft total market strategy for all family planning methods. So I don't want to give the poor impression that it was solely focused on condoms. It just so happens that a lot of the work that has been done in Uganda has focused on condoms.
Great, thank you for that clarification. And also we have a question from both the Mali and Uganda case studies. This attendee is commenting that it seems that for those two countries that the role of the private sector is somewhat notional, and that their participation in the countrywide discussions seem to be patchy. The person is asking whether it would be fair to conclude that the private sector's limited engagement might be a reason for the lack of movement with aligning the policy and market objectives.
That's an interesting question. I think I would say I don't know the answer to that question. I think, in terms of, as Kate was mentioning in her remarks, we certainly recognize, well, obviously there's a much stronger private sector or potential private sector engagement in Uganda than there is in Mali. So there are two different contexts, obviously. But if you take the case of Uganda, I think in the interviews that we've had with the various stakeholders, and including from the commercial sector, they are ready and willing to take on a bigger share of the family planning markets. So I think what it gets down to is, as we were talking about throughout the presentation, how do you move into aligning some of those? And there's a recognition also from the government that that is the way that they need to go. So how do you move from some of that sort of initial awareness raising, data intelligence gathering, advocacy, and actually move into making some concrete policies that will help change what's happening in the marketplace and also align, the various market players. So that's the difficult part. I don't think it has anything to do with the willingness of the private sector to engage so much, but just having a clear way forward in terms of the other stakeholders. And then, of course, the other factor I think that we mentioned in the paper is alignment among the donors as well. And so I think, I think Uganda is another good example where some of the donors are kind of on board and support the TMA approach and framework. That doesn't necessarily translate into consensus around what the key next steps are. So that's the hard part, obviously, in moving to action.
Great. I also just wanted to make one more little note about Uganda. I think what Cindy's saying is absolutely right, that we did see this interest from the commercial sector in engaging and becoming more involved in the family planning markets. But the sort of what we heard echoed across commercial sector players was that it was more about the structure of the sort of engagement mechanisms than anything else. They needed a way to engage with, a working group that they felt like they would get something out of it at the end of the day. To use the term, action-oriented. We want to make sure that, if we spend our time participating, that our concerns are answered, and that we're just as much part of the group as the typical participants, like donors and NGOs.
Great.
Safia,
Yes.
if there's time, I see that there's another question from Kuyosh, who was asking who was playing the stewardship role in the different countries and how it differs. And I think that relates to sort of one of our key takeaways in terms of moving forward. So I did want to address that question. So in the case of Mali, I think in the case of all three countries, just to summarize very quickly, it was basically different departments and divisions within the Ministry of Health. In the case of Mali, it was the DM, or the Department of Pharmacy and Medicines, that was playing that role. In the case of Kenya, I think it was the Reproductive Health Unit within the Ministry of Health that was playing that role. But I think one of our key takeaways in terms of the stewardship function and lessons learned is, it's important to be looking at building that support across the Ministry of Health, so not relying on a single department or not relying on a single champion. And that would be one of the key lessons learned in terms of moving forward, and making sure that when there's a change in leadership at the government level, that does not affect efforts to continue this idea of strengthening engagement with the private sector and looking at what the total market is doing.
Great. Thank you very much. And obviously, this has been a very engaged webinar, in that the questions and comments have been continuing to come in. We are, please continue to send in any questions that you have, and what we aren't able to address, as we will be coming up soon on the hour. We will certainly have the presenters follow up with you separately. We'll provide answers to questions later when we follow up after this webinar with the recording. So please know that your questions will be addressed. And additionally, Francoise Armand from Apt Associates would like to share a quick takeaway from their TMA activity in Tanzania. So let's see if we can allow Francoise to have a word.
Okay, can you hear me?
Yes, we can.
Oh, okay, great. I'll make it really quick. Thank you, Safia. And thank you, Cindi and Kate. That was a really interesting presentation. I just wanted to say very quickly that the TMA activity that we're managing in Tanzania right now, it's very similar to the Kenya TMA work. What I would say is that there's a particular challenge in decentralized systems. So our experience in Tanzania is that it doesn't really matter how much work we did within the Ministry of Health, changing policies, having TMA strategies, even training people on how to apply TMAs. At the end of the day, you have to work at the district and regional level. In Tanzania, that means working with the government entity that manages district and regional services. And that's the President's Office for Regional Administration and Local Government. The practice at that level is really what needs to be changed. So policies only go so far. At some point, we really have to work at the practice, the everyday system that is being used to budget and allocate resources and to engage with the private sector. So that has been our particular challenge, but we will be documenting how we are dealing with it in the next few months. So thank you.
Thanks very much, Francois. And that is certainly with some of the work that HP Plus is doing in Malawi in helping with the implementation and of the national condom strategy. That has also been one of the key issues. So the HP Plus project there has been doing a lot of work in terms of doing that district level support and bringing the DHAs and RHAs together and discussing and identifying the gaps and the barriers, and even at that level engaging some of the private sector players. So totally agree with your observation about the decentralization aspect.
So as we are now coming up on the hour, again, thank you so much, Kate and Cindi, for this valuable webinar, helping us to think in some new ways, perhaps about TMA, and helping us to appreciate more the particular experiences in the countries of Mali, Uganda, and Kenya. We really appreciate this, and we appreciate everyone's attendance today. Later, we will share the recording and presentations via the listserv and address any questions that may have been remaining. So thanks again, and have a great day.
Thank you, Sophia. Thank you, everyone.
Thank you, Sophia. Thanks.
Take care. Bye-bye.
Bye.